Hello everybody, my name is Pedro Marquez and I'm going to give you an explanation about dyslipidemia. The etymological definition of dyslipidemia comes from dys, which means abnormal, bad or difficulty, lipid, who means lipid, m, which means blood, and aya, which means quality. The concept from this word is the imbalance of lipids such as HDL, LDL, or VLDL in the blood vessels. The first part is about cardiovascular diseases. Let me ask you a question. What are cardiovascular diseases? They are a group of disorders related with the heart and blood vessels. They are also acute events and are mainly caused by a blockage that prevents blood from flowing to the heart or brain. As we can see in this image, the normal artery has no impediment for the blood, but in the second image, we start to see this cumulus of fats called plaque. And this is dangerous because in conjunction with blood clots can cause the following diseases: coronary heart disease, cerebrovascular disease, peripheral arterial disease, rheumatic heart disease, congenital heart disease, and deep vein thrombosis and pulmonary embolism. Basically, depending on where the obstruction occurs or if the disease is hereditary. Data from World Health Organization provides an estimate of 17.9 million people died from CVDs in 2019. Almost 32% of global deaths correspond to cardiovascular heart disease. And in those 32%, the 85% is due to heart attack or stroke. The risk factors for CVDs are classified into categories: non-modifiable and modifiable. The first one is the age, sex, race, and hereditary factors. And modifiable, these are factors that you can change, for example, the diet, physical activity, tobacco, alcohol, and your lifestyle. Often, there are no symptoms of CVDs. The first symptoms that you're going to suffer if you have a cardiovascular disease are heart attack or stroke. If you were having a heart attack, you can feel pain or discomfort in the center of the chest, or pain or discomfort in the arms, left shoulder, elbows, jack, or back. They are specific areas as you can see. If you have a stroke, you can easily identify these symptoms: weakness of the face, confusion, difficulty to walk or speech, headache, even fainting. You need to detect CVDs as soon as possible because you may be able to start treatment with counseling and medication. One way to reduce the probability to suffer one of these diseases is having a healthy life. I mean, cessation of tobacco, reduction of salt in the diet, eating more fruit and vegetables. There are some examples. The treatment to patients with cardiovascular diseases include basic medicines: aspirin, beta blockers, angiotensin converting enzyme inhibitor, or statins. The next subject is body mass index. What is body mass index? It's a measure which connects your weight and height, and this says if your weight corresponds to your height. If you have certain height, there's a range of weight that you must have. The formula is simple. You have to divide weight over height squared, and this is the classification. 18.5 to 24.9, it's normal. 30 to 34.9 is obese. and that's all you need to know. Let's add more data to be more accurate. The waist circumference is a measure to the visceral fat, and this is important because you can know if you have an increased risk or are greatly increased risk. Over 94 for male or over 80 centimeters for female. The case report is a 49-year-old female with a height of 1.49 meters and a weight of 87 kilograms, waist circumference of 122 centimeters, and a BMI of 39. She smokes and drinks regularly. She doesn't engage in physical activity. She doesn't have diabetes, but suffers from hypertension. Her family story of diabetes and hypertension is positive. Combination of triglycerides, total cholesterol, HDL, LDL, and VLDL give the next data: 168 for total cholesterol, 61 for HDL, 247 for triglycerides, 49 for LDL, and 57 for VLDL. Those concentrations are measured in milligrams per 100 milliliters. There are the charts for normal values. We found the following risk factors in this patient. The first one is the BMI. The BMI is obesity grade 2. The waist circumference increased the risk of CVDs, physical activity, tobacco use and harmful use of alcohol, unhealthy diet, hypertension, and her values of VLDL and triglycerides high. According to the Fredrickson classification, the patient has type B, endogenous hypertriglyceridemia, because of the VLDL and chylomicron high values. These are the reference, and thank you.